Hi, welcome to the Recovery Roundup, our monthly exploration here at Calvary of sobriety, community, and well-being. My name is Carrie Dury, and I am the Director of Business Development. Thanks for joining us on this month's episode. Today, I am joined by Tamara Luckett, our Clinical Director. So thank you, Tamara, for joining and taking a few minutes out of your very busy day. We really appreciate it.
Sure, you bet. Thanks, Carrie. It's a pleasure to join you.
Thank you. And I feel like this is so long overdue. For those that don't know, Tamara is still somewhat new to Calvary. She joined us this past fall-ish, I want to say.
October, yes.
And I have been meaning to sit down with you and ask you some of these questions. And I think now's a great time, probably better than ever. So thank you again for taking the time. So today's, really the big topic for not only today, but for the entire month. And it's a really cool thing that I'm glad we at Calvary can bring awareness to and recognition to is National Social Work Month. And who better than you, Tamara, to have on for this episode to talk a little bit about what it's like in this field, being a licensed clinician, and how that relates to you. So if you wouldn't mind sharing a little bit about your background, what got you to this point and why you feel, this is the right field and, compelled to do what you do. Because I know I see it every day, but I would love to hear from you.
Sure, you bet. I'm happy to share. So many, many years ago, I had a family friend who, when I was kind of deciding which route should I go, should I do counseling or social work, gave me the advice, although counseling is a wonderful profession and field. I work with fantastic counselors every day. Really advised me to move in the direction of social work because there's such a broad range of work that you can do in the profession. And it would give sort of some more opportunities and some flexibility. So I did choose social work, but even before the mentor from our family gave me that advice, what really drove me was I began volunteering in the community. So I had a whole other profession prior to social work, and really volunteering in the community taught me the value of grassroots advocacy, policy change, and it also helped me see what the needs were in the community. And what I found was so many issues have an underlying foundation of mental health and substance use. And so I felt compelled to really work in that area. And so I went to school, did a master's degree, and then really began my early career in child welfare. Because what I found was in child welfare, we were working with kids and families. And again, the underlying primary causes for a lot of reasons that kids end up in child welfare systems is substance use and mental health issues. And, that really sort of drove me into the field. And I moved through child welfare and then more into substance use treatment and behavioral health treatment services. And I've done an array of various types of services throughout my career, always focused on wellness, substance use treatment, and mental health treatment. And I really feel like those things are such underlying causes of so many of our other social issues. Mm-hmm. And truly, folks that have co-occurring issues. And I truly believe that many people that have substance use issues and treatment needs also have depression and have anxiety and lots of psychosocial factors that can be addressed through social work. And clinical social work especially, because when you're a clinical social worker, you're trained on not just how to provide the counseling services needed, but you also look at systems and you look at the family system the individual came from. You look at where they're going and the system that they need to move toward for a healthier lifestyle.
Mm-hmm. You mentioned you first worked with children, and I know obviously for us at Calvary, that is, we're an adult only program. So what are your thoughts on making that transition? Was that something that was a little, I don't know, it's always eye-opening, but perhaps difficult for certain reasons in both areas, and challenges in both, but was that transition pretty seamless and you felt compelled to move in that direction after working with children?
I did. When you work with children, you automatically work with the adults that
Oh,
care
yeah.
for them.
Yeah.
And that could be, any number of relatives in the family, and even family friends that are caregivers. And so automatically, when you're working in child welfare, which I did, really early on in my career, I found myself working with all the adults, even more so than the children. And so it was a very easy transition for me, because I believed that early intervention was, and I still believe early intervention is really helpful. And certainly early intervention in children's lives, but the way to get through to children is through the adults in their lives. Yeah. And so having intervention with the adults, it was a very smooth transition for me.
Okay, it's good to know.
If we create healthier adults, we're going to have healthier children.
Yeah, exactly. That's so true. So then as you move through, the behavioral health world and, all of your experience with mental health, talk to me a little bit about moving into a substance use specific facility. So, what we see at Calvary, as you mentioned, is very much the co-occurring world in which substance use, but also, like you mentioned, depression or other type of mental health disorders are present. But knowing what we do, and that substance use as our primary focus, I'm curious to know your thoughts on that, and how that's been for you, given your background.
Well, I think, whenever you enter a new facility, a new treatment center, or, you're changing to a different form of the work, there's always a learning curve. So, I love that part of the work, is learning some of the newer things that another facility might be doing. But I've been working in substance use for so many years, because even though my original intention early on in my career was not to work in substance use treatment, that's what I ended up working with. That is so prevalent across so many of the psychosocial issues that social workers work with, with individuals and families, that it was such a common theme and thread. I found that, I've really been working in substance use treatment for many, many years. And, I've also been at the same time working in mental health and trauma, and, all kinds of areas of mental health that merge with substance use, and, really sort of compound the issues that folks are dealing with. So for me personally, I found it to be a very easy transition, because I needed to know about substance use from the very beginning of my career. And I've just been able to really build on that knowledge over the course of the years. And I think having some mental health experience, especially inpatient and outpatient treatment experience, different levels of care, lends very well to the environment at Calvary, because I might be able to identify that there are some underlying things going on with the patient a little bit earlier in treatment, where we might need to really focus on not only on substance use treatment and kind of the primary things that Calvary is known for, but we might also need to work on trauma, for example. And so, working with the staff here, helping them identify, when it's really important to work on depression, trauma, anxiety, and even all the other psychosocial issues that folks that come to substance use treatment are dealing with in their lives. Because once they're done with treatment, they're going back into their lives, and helping them understand some of the changes that they need to make in, the other areas of their lives: housing, employment, family relationships, intimate and personal relationships, and working with them on those things as well.
Mm-hmm. So you mentioned a little bit about some of the different types of therapies that we're working with our patients on and helping them through. And so for the last few minutes here, I would love to get, as our clinical director and, really the leading force behind all of the treatment that we're providing on both an inpatient, outpatient level. I would love to get your take on, currently as we see it today, the patient experience at Calvary, how we're uniquely tuning that to meet their needs. And then if for a few more minutes, maybe we could talk about, how that may look in the future and what we can do, beyond that. So I guess we, on the inpatient side, perhaps the residential program, that's where a lot of this happened. So would you mind sharing your thoughts on that?
Sure. Well, Calvary historically has been known as a substance use treatment facility. And, I think over the years we've been able to evolve. And so as a patient comes to us for treatment now, what they will experience is what I consider a very unique environment. Lots of our staff are very focused on recovery. Some are in recovery themselves and bring that unique perspective to patient care.
Mm-hmm.
I think that's an important perspective to have on board. It's a nice option for patients to be able to choose a traditional track of treatment or a spiritual track. So we do have a kind of a non-denominational and Christian track, and many of our patients select that, but we do have the two, and that can meet, a large variety of patients' needs. And within that structure, we offer a lot of 12-step recovery principles, but we also utilize theories like cognitive behavioral therapy and dialectical behavioral therapy. We've been able to do some approaches around EMDR for trauma and sand tray therapy. We incorporate also music therapy, art therapy, some of the experiential types of therapies. And we bring in wellness components. So we have our dietitian working with patients on, how to have a healthy diet in recovery. We also offer yoga and TRE. And, we're looking in the future to bring back some of the things that we kind of had to put on hold during COVID. And, things are improving in Arizona. We're not, out of COVID at this time, but as numbers begin to decrease and vaccinations are made more available, we're able to sort of bring some things incrementally back into treatment that we had to stop doing. On-site family programming is going to be able to come back at some point. We're doing a lot of that virtually now. And so someday soon we might be able to have a mixed virtual and in-person kind of program that allows for some more social distancing to occur while we're still in COVID. And we might want to, consider bringing back some animal-assisted therapy. In fact, over Easter, we're looking to do our first field trip and activity, bringing that back since COVID, because we had to put all of that on hold.
Yeah.
So we're going to do a nice outside activity for our patients on Easter, and, bringing back a stronger trauma track. I also want to really focus on opioid use, because we have found that patients that have opioid use disorder are really challenged when they come into treatment. We understand why, and we want to help them, because often the cravings that they experience and the urge to leave treatment is so much stronger for that population. So we want to do some programming in the future that really focuses on how to help those folks stay in treatment a little bit longer. And, again, working more on a stronger trauma track and a track for patients that have gone through treatment before. You know, many individuals that go through treatment will relapse, and some don't ever experience relapse, and some do. And so for those that do, we want them to come back without shame. We want them to come back and feel welcomed. And we want to have some programming that's a little bit different for them because they've already gone through programming before. Right. So over the course of the next year, those are things that I hope to work with our Calvary team and bringing to the treatment here.
Well, that all sounds great to me. No objections over here on this side. I know it's been really tough for everybody, you know, but especially for an inpatient setting like ours, for our detox and residential folks who are there for extended periods of time. It presents a very unique set of challenges for, you know, the cohabitation for extended period of time. So I'm excited to hear that we're slowly but surely, cautiously and safely taking a few more steps in that direction. I know patients and staff will be excited to do that, because you're right. As you mentioned, there are so many things that we can throw into a treatment plan. You never know which one is, you know, gonna click and work. And we've talked about this a lot. And the more that we offer and give options to, oftentimes the better results. Something may stick and a seed may get planted. So I love hearing that. I know it's been really, really tough for everyone, but especially our clinical team to try to get creative during these times. So I'm excited to hear that moving in a different direction. That's really good to hear.
It is exciting. Mm-hmm.
Yes, well needed. And we have to take advantage now, before it gets too hot, if we're going to be outside here in Arizona. So, well, that was really all I wanted to chat with you about today. And I really want to thank you for sharing a little bit of insight, not only on the personal side and, you know, what brought you into this field, but then also, you know, what we're looking, not only currently doing at Calvary, but where you know, you want to take us down this path as our clinical director. And as we said, slowly and methodically start implementing some changes to keep the latest, most innovative, really the most impactful treatment that we can for our patients. So thank you again. Thank you.
Yeah.
Thank you all for joining us on this episode of the Recovery Roundup, and we'll be sure to see you next time. Take care. Bye-bye.